This may not look like much, but the wireless CardioMEMS heart failure system is revolutionising the way Southampton General Hospital is treating heart failure patients.
Whereas before we've had to wait until a patient gets symptoms of heart failure, things like breathlessness or swelling in the legs. Often by that point it's too late to do anything about it, and the patient ends up in hospital needing strong doses of medications to fix the problem, which is very costly to the NHS and obviously not nice for the patients. This system actually enables us to see what's going wrong very early. It's a very early marker that something's happening to the patient, and enables us to institute therapies early enough to prevent admission to hospital.
Dr. Flett has just implanted the first monitor of its kind into a patient at Southampton General, but the treatment is only available for patients with heart failure who have already been admitted to hospital once before.
It's a very small device that goes into the pulmonary artery, and we put it in via a tiny hole at the top of the leg, put a very small tube up to the heart, through the heart and into the lung, and measure the pressures within the lung itself. And then we can calibrate the device once it's deployed in the artery, and then it just stays there. And the good thing about this device is how small it is, also that there's no moving parts, there's no battery, and so there's nothing to go wrong, and so in theory it will last forever.
In order for the device to work, the patient lies down on a radio frequency transmitter pillow which beams energy to the device. The signal that then comes back reads the pulmonary artery pressure. The aim is to take the pressure off of the NHS by monitoring conditions remotely, and if an anomaly is detected, doctors can intervene before admission to hospital is required.
It is using new technology, so this actually uses the internet to send these readings to us from the patient's home. So the patient doesn't have to come into hospital, which can be time-consuming and inconvenient. We actually see the readings live every day. So this is the data that we get in, and this is the time along the bottom here. You can see that every day we're getting readings of the pulmonary artery pressure, and you can see it sort of trends up and then trends back down. But if it continues to go up, then we can intervene before it gets too high.
But a treatment as technologically advanced as this comes at a cost.
It's not clear how much it's going to be in the long term, because it is early days for this country. But they're certainly not cheap, and we need to make sure that it is a cost-effective therapy. But hospital admissions are very expensive, so you only have to prevent 2 or 3 admissions, for instance, to pay for the cost of the device.
The CardioMEMS system is currently being trialled at Southampton General Hospital, and if successful will undergo cost-effectiveness analysis before being rolled out more widely across the country. This is Rhea Barton for That's Solent.